Two of the biggest things on people's minds as the pandemic continues, of course, will children be going back to school in the fall? And what will sports look like for really the rest of the year?
A lot of questions about that. Dr. Jeff Pothoff is the Chief Quality Officer at UW Health and our frequent guest here on Live at 4 and News 3. Welcome back, Dr. Pothoff. Good to see you.
You know, good to be back. Hey, one quick thing. I just want folks to know that I am in a large room by myself, and we want people to be able to hear me articulate and see my lips if they're hard of hearing. So even though we wear our masks almost all the other times around here at UW Health, I am going to take it off just so that we can communicate better with the audience.
And we want to mention the same thing. We are we're at a distance. A lot of times we as anchors are the only people in the room or at a distance from a camera operator as well. We've gotten a few emails asking, but we always move with these in the building, and there is an exemption for Wisconsin broadcasters as well.
Every time we leave the set, we put them back on.
I want to make sure we get these very important messages clearly across. Let's talk about schools, Dr. Pothoff. This is something so many superintendents are dealing with. I'm trying to keep up with the emails from my children as they get ready to figure out what they're going to do. What are you guys, are you talking to superintendents? How are you guys involved in this process?
Yeah, I've had a couple conversations. I know that they've been talking to public health, and to be honest, they've got their work cut out for them. On one hand, we know, and they certainly know, that kids definitely benefit by having in-person instruction. And on the other hand, we're in the midst of a pandemic, and although there are some countries who have had school, none have had school when their cases are rising and there's such community spread. So to balance those two things, the need to try to get kids in school and the logistical obstacles of making sure it's safe to have them in school is a challenge that all school districts across the country are facing right now.
What do you think schools have to be keeping in mind in order to do it safely for students?
Yeah, so it's really those three things we talk about, and you have to apply it to schools. So good sanitation practices, how are they going to keep surfaces clean? They're going to have to discuss mask wearing and how that's going to work, both with students, older students, and very young students, as well as all of their staff. And then really the thing that I think can be the most challenging is socially distancing kids in a classroom when really our schools aren't set up for that. Our educational system with group work makes that a little bit more difficult. So I think those are some of the challenges that our school leaders are really trying to work through and find a solution.
It's so tough because, kids eat better when, some kids don't have food at home. We've talked about that in the past. There's so many positives to being in the classroom setting, and a lot of us who have kids can't teach them as well as our teachers can either. Let's move on to sports, because that's another big thing. We're heading just weeks away from high school football programs starting to open. What recommendation? I mean, are some sports okay and others not?
I think some sports are easier to do safely than others. I think when you look at team sports where there's really no way to play the game unless you have those athletes close together in close physical contact, those sports get a lot harder to do. At the professional level, maybe you can do daily testing, like they're doing in Florida, isolate the basketball players in one location. For high school prep sports, that's going to be hard to do. Those kids have got to go home. They're going to be in the community. We probably don't have the resources to do the testing as often. So I think, our local schools and those sports are going to have a bigger challenge than, say, even the professional sports as far as just getting players on the field. And then we have the whole issue of what to do with stands. People in the stands, how do you safely do that? Can you socially distance? Will they have to wear a mask the whole time? What will that look like? So again, significant challenges as we look forward to fall sports.
And still no clear answers. You raised a really good point earlier, Eric, about should all sports be created equal?
Can you play golf? But not football.
But not soccer. Right. Dr. Pothoff, let's talk a little bit about the hospitalization rate in Dane County. It went up again today, and certain areas of the community are being affected more by the virus than others.
Yeah, so this hospitalization rate is something that we watch closely because we know other states who are a few weeks ahead of us, there is a delay between the big increase in cases, which we are experiencing in Wisconsin, and when we start to see hospitalizations. The day that I get diagnosed, I might not be that sick, but days later, I start to get sick enough where I need to be in a hospital. So we're watching that very closely. That worries us. You know, the other thing that really bothers us in healthcare is just like across the country, here in Dane County, we are seeing that African Americans and Hispanics are disproportionately affected by COVID-19, and not because they're somehow different or they're made different genetically. It really has to do with social determinants of health and their and kind of their ability to get great care in the medical system. So that bothers us. I think that should bother everyone, that a certain segment of our population is suffering more with this disease than others of us.
Boy, so much work to do, both from a social aspect, education, and healthcare as well. Dr. Pothoff, always great to talk to you. We really appreciate your contributions in informing people here.
Yeah,
Thank you so much.
Thanks for being so generous with your time and guiding us through this week by week. We appreciate it very much.
All right, have a good afternoon, guys.
All right, great to see you. And we'll be right back.